Hello. The scorching heat is gone, and we are absolutely in the rainy season. We were waiting for it, but the rainy season does come with its own shares of problems, and especially with dealing with the kids and the small babies. The rainy season does have its own specific problems. Of course, the cold is still there. The cough and the viruses are all around now. But to add to that problems is the lot of waterlogging that you have, and that's a breeding ground actually for the mosquitoes. So of course we have a share of problems in the form of dengues, malarias, as well as the waterborne diseases like the cholera, which really is a lot less now, but a lot of enteric diseases like the typhoid, the bacillary dysenteries, the viral diarrheas and all that. So we are not in a happy scenario. And of course, to add to it, we have this respiratory illnesses like the flu and the adenovirus and the rhinoviruses and all that. Also, we have a little bits and pieces of those hand, foot and mouth diseases and other things like that. So it's not a lovely, time for the kids, but yes, they suffer. Though not a lot, but we need to really know what to do and how we can manage these. The first and the most important thing that I would talk about is the hygiene, of course. To prevent an infection during the rainy days, the most important thing is hygiene. So you should wash your hands properly. You should make sure you should use good potable water. You should carry potable water. So in water bottles, you should carry and make sure that the food is taken well care of. The food is prepared well, hygienically prepared, and the water is boiled, or you can use one of those filters which are really good. And also make sure that the vegetables are well washed, the fish or chicken, whatever you have, is well washed and prepared properly. So that's important. And the use of utensils is very important. You must make sure that you shouldn't have food from outside. Street food, I would be a little wary of taking street food. You should use a lot of sanitizers if possible. A regular soap bath is mandatory. Even if you are having cold or cough, there is no substitutes for soap bath. Washing the hands with proper soap and water. The early treatment of infections is very important. Once you have a little bit of cough or cold, which is persisting for a day or two, or it's causing a lot of vomit or a lot of diarrheas, it's better that you see your doctor early. For a lot of fever which actually comes around this area, you should have a lot of paracetamol. Make sure you have a proper bath, a cold sponging if the fever goes up high, especially in dengue. Remember, dengue is very prevalent at this point of time. And a couple of important things to mention here is you must know the warning signs of dengue or in any fever basically. If the child becomes very lethargic, very drowsy, dehydrated, non-responsive, bleeding, and not the real self, in those cases, you need to see a doctor pretty quickly. Otherwise, plenty of fluids, analgesics, and antipyretics in the form of paracetamol is really good. Do not use ibuprofen because we don't know if it's dengue, and ibuprofen can lower the platelet count quite a lot. Vaccines are very important, so you must remember that you should take most of the conventional vaccines like polio, DTP and MMR and all those. Along with that, you need to take the typhoid vaccine if possible. The flu vaccine is very important because we are having a lot of influenza A as well as B as well as other viruses for which there is no specific vaccine. So hygiene is important. If somebody is coughing around you, make sure that you cover your face with the conventional mask that we were using before. And really in smaller children, breastfeeding is of utmost important. Breastfeeding does protect against a lot of viruses and a lot of bacterial infections as well. So on the whole, you must remember the most important thing is hygiene. Make sure the water and the food that you're taking is absolutely okay. And lastly, have a low threshold for going to the doctor. So if the fever persists beyond 72 hours, if it's very high temperature, if the child is becoming unwell, if there's a lot of vomiting, lot of diarrheas, then you really need to take a lot of ORS, you need to take a lot of fluids, and make sure you see your doctor right and quick. You can even talk to your doctor and get to know what needs to be done. I wish you a very happy rainy season with the pujas coming around the corner. Everybody should gear up to enjoy, but make sure you take care of your health. Thank you very much.